Listo.
Good evening. Our project is factors that determine the level of adherence to exercise in adult patients over 30 years of age with arterial hypertension in the out of hospital setting in Colombia in the last 10 years. As general objective, we have a review of the protective factors that promote therapeutic adherence to physical activity in adults older or equal to 30 years with hypertension in the out of hospital setting in Colombia in the last 10 years. In the specific objectives, we found four are to investigate the protective factors that promote adherence to physical activity in adult patients with hypertension in the out of hospital setting in Colombia. To select articles that can be used taking into account the inclusion and exclusion criteria of our project. Analyze the information on the protective factors that promote adherence to physical activity in adult patients with hypertension that we highlighted from the selected articles. And the synthesis each of the factors we found in the articles and select the main ones.
Regarding the frame of reference, we first find the context we were observed that hypertension affects more than 30% of adult population. Its prevalence may decrease or increase depending on different risk factors, such as sedentary lifestyle, poor healthy habits, and smoking, among others. For the correct management and control of hypertension, it is necessary for the patient to maintain adequate adherence to non-pharmacological treatment. In the fact, adherence to non-pharmacological treatment in patients with hypertension in Colombia is 9.4%. Actually, 70% of these patients don't have adherence to physical therapy. And knowing this, it's important to specify what are the factors that determine adherence in this population.
So for that, our studio is important for concept about the how to most handle our study. First, we have the adherence to non-pharmacological treatment on hypertension is disagree in which the patient followed the prescribed treatment. Second, we have physical exercise, as you know, is the most general activity, is irregular each person. Third, we have the protective factors is the our condition as the person you have in a specific situation. And the last, we have the illness, arterial hypertension is the what the concept important according to the definition of who.
As theoretical framework, we have the physical activity as non-pharmacological treatment in adult patients with arterial hypertension, and these achieve benefits such as acquisition of healthy habits, lower mortality rate, and reduction in blood pressure. All of these forms of exercise are effective, and the benefits that could not be achieved by using medication alone.
Okay. Also, the adherence that were the factors that improve the adherence to patients with hypertension that we found was the age, the level of education, the economic status, and an effective family support and attitudinal of patient facing the disease and the treatment and health service of the patient. Also, it's necessary to accurately evaluate the behavior of therapeutic adherence and understand promote the factors that facilitate the adherence to the exercise.
The methodology for the risk will be a systematic review in by days, SUS and Cielo, Cyber Clinical Care, among other, of articles of the last 10 years of antiquity in different languages, English, Spanish, Portuguese, on factors that determine the level of adherence to exercise in adult patients about 30 years with hypertension. Using measures terms hypertension, exercise protective factors from ago of the 2021 to November of the 2021. Finally, a document will be built with all the information in the articles. Thank you.